I call this January 28th, 2025 regular meeting of the Burlington Board of Health to order. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Go to the next slide. Well, good evening, everybody. I am Dr. Ed Weiner, and I'm chairman of this Board of Health. And with me this evening is my vice chair, Gail Demore, Mary Beth Welch, Andrew Sheehan, and Mara El Sabahi. Also with us this evening are other professionals: Susan Luminello, Director of Public Health; Michael Green, Director of Public Health; the environmental engineer, Christine Mathis; and Marlene Johnson, who is health agent. And I guess online is our recording secretary, Ms. Julie Falkingham. Is that correct? Mm-hmm. Okay.
Yes, I'm here.
Thank you.
Thanks.
I want to thank the Burlington Buzz, our Burlington daily newsletter, for covering our meetings. And a number of people have commented on the updates, and we thank you. And as always, please note that we are live on and will be taped by BCAT and available for appropriate comments and questions through this video technology. And as always, thank you to BCAT for what you do for this community, keeping us all aware and so well informed. Thank you, BCAT. We have first order of business, we have approval of minutes, and we have October 27, 2024, November 12th, 2024, and December 10th, 2024. So we're going to take them in order. Does anybody have any issues, corrections, omissions for October 27, 2004? If not, could I have a motion to approve?
Motion.
I have a motion by Ms. Demore, second by
Second.
Ms. Sheehan. All in favor?
Abstain.
Okay. That is, so it's 4-0-1. Thank you very much. Also, November 12th, 2024. Do I have any corrections, omissions, additions, deletions? Could I have a motion to approve, please? Ms. Dr. Sabahi, second by Ms. Sheehan. All in favor? Aye. That's 5-0-0. And last, we have December 10th, 2024. Again, do you have any additions, deletions, comments? I have one, and I don't know the answer to this question. We had a vote in which it was not unanimous, and that doesn't happen very often. Do we need to, and I'm asking the recording secretary, because I thought I saw this in another board, that they have to list who was in favor, who was not in favor, and who abstained? Do we know that?
Sure, yeah, every board's different. I can definitely fix that and put that in. I can do that going forward.
Okay.
Well, I want to answer to your question.
Yes.
Is it a requirement?
I don't know. I don't
She
know.
just said every
sure.
board's different.
Yeah, I'm not sure on that.
Have we done that in the past? I mean, if it's not a
Do
requirement.
you remember whether we've done that in the past?
I don't,
You don't.
I don't remember.
I've never seen it on any minutes, so, since I've been here.
Okay. I mean,
Just-
if,
I like the answer too.
do you like the answer too?
No, I'd like to know
don't-
what,
What's
the rule?
is it a requirement?
I do not know. Can we just, then, can I have a motion to table these until the next meeting? Till I find out. I don't know the answer.
Yeah, so Julie, you're not sure of the answer to that?
I'm not.
Yeah.
Yeah, I'm not sure.
Maybe ask the
It
town.
doesn't
The
make,
town
it doesn't,
council?
Yeah.
The town council.
it doesn't make a big hill of beans. It really doesn't. But I just happened to see them in another set of minutes for another board way back, and I don't know the answer. So, can I have a motion to table these?
Motion approved.
Second.
Second to a table. Table.
Second.
Second by Ms. Welch. All in favor?
Aye.
Okay, 5-0-0. That takes us to citizens' time. Is there anybody here who is not on the agenda who would like to speak to the board? So everybody's here on the agenda, great. Is there anybody online?
No.
Okay, can we move on to Chairman's report? Well, this is our first meeting of the new year. We did not have a meeting in the second week of January. We had no agenda items. So, Happy New Year. 2004, the Board of Health was one of the most busiest municipal agencies in both the town and in the region. From the regulation of over 200 restaurants and food establishments to the many hazardous material inspections and continued remediation actions, from the numerous land use proposals that were reviewed to the countless public health programs and initiatives that we sponsored, including our annual health fair. And we're going to do it again this year. And I can't forget the many community clinics. We had quite a year. With so many scientific and biotech laboratories now within Burlington, and the participation and administration of Triton, a regional public health grant initiative, and of course, our highly active Medical Reserve Corps. This board is leading the greater community in public health. 2025, we will see all this again. Not only these programs, but even more innovative ways to keep us all safe and well. So, take a look at our Board of Health website if you have the time. Come to our programs. Join our MRC. We're always looking for more members. And if you have any questions, give the office a call, or you can even reach out to any one of us, your elected board. Any comments or anything, do I want to add anything to the new year?
I agree with the, looking for volunteers for the medical reserve. And some folks, I think you mention it usually, but some folks think it's just medical volunteers, so it's not. So I think you usually mention that, but I think it might entice others to get involved.
Thank you very much. I think it's a great idea. So, just 1 second, I will recognize you. The Medical Reserve Corps is a volunteer reserve corps, and many people within our community from all walks of life are part of this community group. And we react to not only emergencies and train for emergencies, but also we get involved in so many other programs. So, thank you very much. Did you have something you'd like to say, sir?
Yes, I had a question on this.
Come up to the, and please, just write your name so we know who you are, thank you.
Okay.
Just print your name, thank you. Thank you.
Arif?
Okay, that's okay. And your last name too, please?
Okay.
Yeah, we just need, okay, thank you. What would you like to add?
So for Medical Reserve Corps, there are many community members from our community
Yes,
who are highly qualified medical professionals from back home and very experienced as well. So there should be some type of town-wide initiative like a hiring or a job fair where, everybody can come and see what type of opportunities are available in medical corps. Because, they come to know about this these volunteers, when they go for vaccination event, which is held by town, and many of them, they don't go to that event because, they have vaccinations from their PCP's office.
so first, it is a volunteer corps. There is no job fair.
Yes, yeah, so sorry.
Second of all, the person on our board, our professional, is Michael Green, who is Associate Director of Public Health. And maybe you could reach out and send some information. I know you have a membership committee to, I would say it would probably be, it would go where? To the Islamic Center?
Yes,
Could you send something to the Islamic Center, please?
Absolutely.
There you go.
yeah, that would be helpful.
Thank you so
Thank
much.
you so much.
Thank you for speaking up. Okay. No subcommittee reports this evening, but I'd like to do something else rather. I would like to take the Islamic Center of Burlington, which has a external grease trap interceptor variance, and the discussion, 8 Virginia Road, the kennel recommendations, because we have some long discussions when it comes to the biosciences and a hearing on health regulations. I'd like to move that we take those out of, like someone asked, take those out of sequence here, out of the agenda.
Need a vote?
Sure.
Yeah, I think we need a vote.
Okay, sure.
So you make the motion. Dr. El Sabahi and the second by Gail Demori. All in favor?
Aye.
So with the Islamic Center, 130 Lexington Street, please come forward. The representatives. You want to, please come. And presenting this will be our health agent, Marlene Johnson.
So the representatives are before you tonight to request a variance from having to install an external grease interceptor. They are from the Islamic Center of Burlington, a house of worship at 130 Lexington Street. And the type of food that they are planning to make in their kitchen is rice, chicken curry, goat meat curry, vegetable curry, lentil curry, beans, and tea. They are in the process of installing a 3-compartment sink. There's already a grease trap there. There's a picture enclosed with the paperwork. And they are providing some commercial refrigeration units, so they're bringing it up to food code standards. Their application is attached, and so the action by the Board of Health, vote yes to approve the variance from Section 2.3, Part A, and allow the new food service establishment to operate without installing an external grease interceptor with the following condition. The food service establishment operator and the property owner, which they are one and the same, both understand that this variance may be subject to revocation, suspension, or expiration as determined by the Board of Health. A variance under these regulations may be revoked, modified, or suspended only after the food service establishment has been notified in writing and given an opportunity to be heard at a regularly scheduled meeting of the Board of Health. Reasons for revocation, modification, or suspension of a variance include, but are not limited to, a determination that food service establishment is discharging grease in quantities sufficient to cause sanitary sewer line blockages or increased maintenance of sewer lines. Or the board may vote no, not to approve the variance.
The one thing we ask is that you need to keep a log when you clean it out.
Yes, so we have contracted with a drain cleaning company,
Okay,
Yes,
we
okay.
have a commercial company do it.
commercial company, John's Drain out of Woburn. So we have
Okay.
contracted with them.
And I have a couple more questions, but I'll,
Thank you. Welcome. Marlene, is this kitchen currently being used? I know that it exists, but is it currently being used or this is new?
They were using it, they didn't realize that they needed a permit.
Okay.
So that's
All
why they're bringing it up to food code standards. So they've stopped
Okay.
right now until they get their permit.
Okay, thank you.
You're welcome.
anybody other questions? The other question I have is, do we have to include the bringing up to standards for this food code?
You don't need to do that.
Did you do that? And the other question is, I want to make sure that if there are any charges or any permit fees, that we're able to waive them.
Yes, they provided documentation showing that they're a nonprofit.
They're a nonprofit, so there are no fees, because
No
I don't
fees.
want you to be any charge whatsoever.
Thank you.
You're a very important group in this town. Thank you for coming.
Thank you. Thank you.
I have no questions whatsoever. Do I have a motion?
So moved.
I have a motion. Do I have a second? It was a motion, a second, so the motion was by Mary Beth Welch, second by Gail Demori. Anything else? All in favor?
Aye.
You're all set?
Thank you so much.
Thank you so
Thank you so much for your time.
Thank you. Okay, that's my agenda. The next is discussion, 8 Virginia Road, kennel recommendations. Come on up, please. And could you kind of flip the page and write your names down, please? Just to run a line. You are?
Jacob
Jacob
D. Dominicus.
D. Dominican. I was going to ask you how to pronounce it.
D.E.
Dominic- And you are?
I'm actually the homeowner, Catherine D. Dominicus.
Kathy Dominican. Okay, thank you. Who is going to present this evening? Please, thank you.
So the occupants applied to the town clerk's office for a kennel license. They originally had 3 dogs, and Jacob, who moved in with them recently, brought his own dogs, so now they have 4 dogs, so they needed the kennel license. The town clerk looks for 2 recommendations, one from the Board of Health and one from the Animal Control Officer. The Animal Control Officer provided a favorable recommendation. We have a new Animal Control Officer, and her report is included in your board book materials. And now they need the recommendation from the Board of Health. Samantha Ellsworth, our Associate Health Inspector, was out there on December 16th and inspected the property and found no issues, and her recommendation is to provide a favorable recommendation to the town clerk's office.
Thank you. Any questions? What kind of dogs?
We have 2 pugs, a pug pot terrier, and I don't know what your dog is.
He's a lab mix. I really don't know. I want to find out, but
Okay. We have positive recommendations. I have no issue. Does anyone have any issues? Then, if there are no issues, do I have a motion to approve the kennel license recommendation? We don't give you the kennel license. We recommend to the town clerk,
Okay.
okay? And this would be for, where is it, right here, I had it right there. 8 Virginia Road,
Correct.
8 Virginia Road, and it would go to, I guess,
Total of 4.
yeah, total, well, we don't need to say how many dogs, do we? It's just a kennel recommendation.
Right.
Yeah. So do I have a motion? Okay. I have a motion by Mary Beth Welch, I have a second by Gail Demore. All in favor? Aye. You will get a positive recommendation now to the town clerk.
And then we'll get whatever we need from the town clerk when that's.
You'll be all set.
Okay.
Everybody says you're fine.
Okay, thank
All right.
you.
Thank you for coming.
Thank you.
Thank you.
On a cold evening, and I think, do we send a letter over?
Yeah, Samantha will email the town clerk's office, and then you get the actual license from them.
Okay.
Okay.
All right, good, very good.
Happy
Thank you.
New Year.
Thank you. Happy New Year to you, too.
Thanks for coming. Okay. Our next is the biological safety permit, HYKY Biosciences, 5 Burlington Woods Drive. We had a lot to read this weekend. And your name, please?
Kathy Dunsmore.
Kathy Dunsmore, okay.
I'm Andrea Zoll.
Andrea, I'm sorry.
She was probably.
Yeah, Andrea Zoll. So Andrea's a scientist, and Ms. Dunsmore is a biosafety officer, correct?
Correct.
Who is going to present this, or?
I will.
Okay.
You can just let me know when to move on.
Yeah, you can go to the next slide, please. So at HYKY, we are a company that's focused on bringing together covalent chemistry with chemoproteomics to identify novel binding sites on disease-relevant proteins. Our current therapeutic drug discovery pipeline is focused on oncology targets. And next slide, please. Our company was founded in 2023. We have currently 15 employees. And you can see our senior leadership team here. You know, you see Andrea, who's our VP of Chemical Biology and Proteomics. And the senior leadership team brings a breadth of experience from big pharma to biotechs and startups. We started our lab operations in 2023 in Lexington, and we just moved yesterday into 5 Burlington Woods. And next slide, please. Yeah, so we're at 5 Burlington Woods. We have about 40% of our space is office space, and about 60% of it is lab space. Our site is secured by badge access, both to get into the building, and then the lab also is secured. The laboratories will be BSL2, and we're going to have the whole entire laboratory designated as BSL2, and there will be lab access, badge access into the lab for only trained employees. Next slide, please. So this is a floor plan showing our lab space and our office space. And you can see highlighted in yellow all the lab space, which will all be designated as BSL2. We have badge access from the office space, and we have a couple accesses from the shared hallway, which will also be badge access. We will have spill kits under every sink, and we have a biosafety waste section of the lab, which will have Veolia Environmental Services come and pick up our waste, and they'll take it through the route you can see there down the hallway to the freight elevator. Next slide, please. So it's key for us to have biological research to support our drug discovery efforts. As I said, we started our lab in Lexington, so we've been operating for over a year in Lexington, and we're hoping to be operational next week here in Burlington. Our biological agent research plan includes, we're going to be using bacterial or transformation of expression of human oncogenes and tumor suppressor genes for assay development, and for also mechanism of action studies and chemoproteomics studies. So we'll have both engineered mammalian cells and also expressing proteins in bacterial cells.
Excuse me for a second, can I interrupt you?
Yep.
There are a lot of people watching on cable access.
Okay.
Is it Dr. Zool?
Yes.
Okay. Either you or Catherine Dunsmore, is it Dr. Dunsmore?
No, I have a master's.
Okay. Would one of you just, for the people who are watching, who have backgrounds not as advanced as yours, just in your own words, tell people what's going on here? How would you explain this to my 13-year-old or
Yeah.
13 grandson?
Sure. So I would say that, what we're doing at HYKY is we're trying to make new medicines for cancer. The key way that we have to do that is that we have to be able to study these I guess in this case, specific parts of the body, in this case, specific proteins that are known to be important in cancer. We have to kind of take those out and study those and test our medicines against them in a sort of controlled way. And that's really what we're doing in the lab, is we're taking those kind of key parts of that cancer, moving them into a setting where it's kind of safe and isolated to test them and study them and develop the medicines against them. And that's what we'll be doing in the lab.
and your products will be for other research laboratories who will use your protocols?
No, we're a drug discovery, we are a biotech company aiming to bring candidates eventually to clinical trial.
Oh, wow.
And eventually, hopefully, to patients.
Very good. So you are developing anti-cancer drugs.
Developing
Correct, yes.
anti-cancer drugs.
Okay, and I'm going to ask you one more question because everybody will be calling us tomorrow. And it's a very simple yes or no. If any of your agents got out into the chimney and came out and came over to the mall, would anybody be affected?
No. No. Everything we're using is low-risk groups.
Thank you. Thank you both. That's very good. Now, please continue.
Okay, yeah, so, I guess the only last point on this slide is that everything was going to be done on an analytical scale, so low level. We're not producing high levels of chemicals or of recombinant DNA.
Okay.
Next slide, please. So this is just highlighting for people who, what kind of cells and what kind of biological agents we will be using. We're going to use recombinant or synthetic DNA. That's just to put into the cells or into the bacterial cells to make the protein of interest so that we can, as Andrea said, we can study those and figure out how to intervene for drug treatment development. We'll be using a variety of human cell lines. We've listed some here. They're all very standard cell lines that you would find in most laboratories, biological laboratories. We'll also be using some insect cell lines and bacterial cell lines, again, to make those proteins so that we can study them. Next slide, please. So one thing to point out is that we had an IBC, or an Institutional Biological Safety Committee meeting, where we discussed our protocols and how we'll be working in the lab, our processes, and those were approved by a committee that includes, experienced scientists and also community representatives. And all of the agents that we're using are what's called NIH risk group 1 or 2. So those are the levels of risk group 1 and 2 are not drugs, or are not proteins that will be of concern. So if they do cause disease, there's treatments available for them. They should not cause serious disease. Just to orient people, the risk groups go up to 4, where like something like Ebola would be a 4. We're looking at things like if, that would not cause disease or there's a treatment available. And so all of the recombinant DNA that we'll be using is not self-replicating. So if it did get out in the environment, it would pretty much die and not be able to self-replicate, and so it causes minimal risk to scientists. All of the work that we'll be doing will be conducted at standard BSL-2 containment measures. This is industry standard. All of the mammalian cells will be handled in a biological safety cabinet. The cell culture media will be decontaminated. Everything before it leaves the premises will be, any of the cells and stuff will be killed before it leaves the premises. All the surfaces will be decontaminated with industry standard protocols. PPE, or personal protection equipment, will be required for all lab spaces. So everyone will have to have a lab coat and safety glasses, and when they're working with the materials, they'll have to wear gloves. And we'll also have additional PPE available if people want it, such as face shields or surgical masks. Next slide, please. And just to highlight, we have obtained all of the permits necessary for the work, not just the biological safety, but we have the wastewater in place, the hazardous material and flammable storage through the fire department. We have the MWRA permit for the sewer through our landlord, and we have the permit issued for our use as well. We had the IBC meeting approved on January 15th. And so this is the last permit that we'll need in order to begin our work. So that's the end of our presentation if you have questions.
Thank you. Any questions?
I was going to ask just a very quick, I'm just curiosity question.
Go ahead.
Sure.
I was just, so did you first open in 2023? So this is like pretty brand new in the company in general, or has it been functioning? Like,
It functioned a little bit before I think it was technically founded in 2021.
I see.
And then when we were like,
2023 was the start of our lab operations
Yeah.
in Lexington, and it's been almost 2 years since then.
And then you just needed like a bigger space, or is that
Yes.
basically?
yeah,
And we wanted to come here.
yeah. It's a beautiful space over there. We've been there 2 days now, so.
Welcome.
Any other questions? Okay, let's start. On page 17, on unstable reactives, and then I'll go through them, so you might want to take some notes real quick. This is very mundane, because I want to tell you your submission was outstanding. I know the boilerplate, the boilerplate of the safety part was very good, but I just have a couple things, and this is the same comments I have made for almost every biotech that comes to town. Page 17, 28, and 30. And where it says fire department, discovery of dry nitro compounds shall be treated as potentially unstable reactive compounds. Notification shall be made immediately to the CHO emergency coordinator, who will notify the Burlington Fire Department and Burlington Board of Health. We have the luxury of an environmental engineer in this community, and we're very active in the Board of Health here. People will call us, but we need our environmental engineer to know what went on.
Okay.
Also, the same on page 28. If you wonder, do we read all this stuff? Yeah, it's a lot. Under remediation, the spill reporting, wherever it says the Burlington Fire Department, please add the Board of Health, which will be our environmental engineer. And again, on page 30, decision matrix for notification, right under the Burlington Fire Department, please put Burlington Board of Health.
Okay.
Because they will call her. We have an expert in this area for environmental risk and remediation, and they will call Ms. Mathis, who is an expert, and hopefully she'll call me, and
Okay,
and
we'll
everybody else.
make those edits.
So please make those edits. Nothing, I found this extremely well done. I've looked at a lot of these, and so have we all. And so,
I have one question.
sure, go
And
ahead.
and if I missed it in your documentation, the hours of operation, and it might have been shared when.
Oh, yeah, I don't think we put that. So it'll be standard business hours. You know,
Okay.
most people are there sometime between 8 and 5. You know, on occasion, someone might be there later, depending on what's going
Yeah, the
on.
labs, the office and labs are available by badge access around this, so there's not standard operating hours.
So first, thank you for coming to Burlington.
Thank you for having us.
Usually right after we have a vote, I'll have a couple more comments. Maybe you get more involved in the community here, but thank you for coming. It's a quality organization. Do I have a motion?
So moved.
I have a motion by Ms. Welch, second by Ms. Sheehan, I want to make sure that I have this correct, to approve the biological safety permit. Ms. Mathis, would be the motion? Would that be okay? All in favor? Aye. 500, welcome to Burlington. Now, we have this is optional to think about it, but we do have a Board of Health faculty. If the high school asks questions, or any of the local organizations would like to know what's happening in the world oncology. We'd love maybe you, Zoll, and you, Ms. Dunsmore, just to be part of that. We never get called, but it's always nice to have a couple of experts from biotechnology on our community faculty. So please consider that. When you get settled, you can give Mr. Michael Green, our Associate Director of Public Health, a call, and he can just put it, we just ask for either a bio or your CV, whatever easiest for you. And Ms. Zoll, were you at AstraZeneca? It said here, in Waltham?
I was.
I had an office there 100 years ago, so.
Small world in the,
I've been,
small world.
I've been retired a long time, so. Anything, well, thank you so much for coming, and welcome to this community.
Thank you very much.
Thank you.
All right. The next is our revision of Board of Health Regulations, Article 1, General Provisions.
Yes. So as you may remember, a few months ago, we codified the Board of Health regulations and basically made it into one large document with all the regulations. That's currently on our website now. What I had just realized is that some of the regulations don't contain, the older ones, don't contain the option for hearings and variances, which is required in all the regulations. So after speaking to town council, her recommendation was to add this portion to the front part of it under the general provisions as administrative procedures for the Board of Health. So that's what I added here, and this is the only section of the codified regulations that will change. It will be in the general provision portion of it. So what I'm looking for is to amend the, this section of the Board of Health codified regulations.
So this doesn't
So
include
that's
anything
it,
new?
it's a housekeeping thing.
Housekeeping.
Yeah.
I have no problem.
And it's something that was there, right? Like,
Yeah.
is that you're saying, it was there, just wasn't added, because they,
It should have been there.
Right, that's
Yeah.
fine.
In this section, so it exists, so my original thought of not putting it here was because it exists in like most of the regulations, and it's already in there. But in some of them, the really old ones, it was missing, which I didn't realize when I codified them. So she said, well, just put it in the beginning, so that way you'll cover it.
Covers everything.
In case it exists somewhere else like,
I see, okay.
And you did publish them?
yes.
They're all published. Do I have a motion?
Motion.
I have a motion by Ms. Sheehan, second by Dr. Sabahi, El Sabahi, all in favor? Aye. Good, housekeeping done, thank you. So, now which brings us to staff reports. And now, these staff reports range approximately November 29th to January 16th, so for all of them. And the first will be the health agent. Is there anything you want to bring up?
I do want to mention that you probably have seen it in the paperwork that we had 2 retail tobacco stores selling flavored tobacco, so it is prohibited in Massachusetts. One of our shared services inspector was doing retail tobacco inspections and found that. And she told them to get rid of it. They took it off the shelf, but she went back. She went back a few weeks later to see if they kept it off the shelf, and they didn't. They put it back. So
Put it back.
they put it back. So I spoke to both owners of both businesses, and I went back myself for an inspection, and we had a constable send over an order to correct, as well as a $1,000 fine. So each one received a $1,000 fine.
One of which, I'm not sure if, one of which at least is a dedicated tobacco store, correct?
Correct.
And the other one is not, it sells a...
Retail store.
Retail store.
Selling tobacco,
we have seen the other one, the dedicated tobacco store here before.
Yes.
One would think that they would understand
Yes.
the laws of their own business.
Agreed.
The $1,000 fine is set by the Commonwealth, is that correct?
Per regulation.
Per regulation?
Yes.
So we don't have any say in the amount?
Correct.
Okay.
Is that for second offense?
That's
Or-
first. That's a
But it
first.
really is, it's a first, because it's different, but it's really not a first offense of the tobacco company. If
Well, they sold to a minor last time.
I
Right,
recall
right.
the situation, so.
Right over the summer, you're
So
right.
this was a different, yeah,
This is a different issue.
yeah.
Different
So
issue,
it
but a
counts as a
second
first? It's a second
violation.
violation, but it counts as a first
First.
new issue?
Correct, because we try to give them the benefit of the doubt. We do a little bit education, we have them corrected on site, and then if they don't, then we come down really hard.
But you did say that you went, that you warned them,
She did,
and then we went back and they were there again.
Correct.
So they ignored the warning, and we just gave them the basic $1,000 fine.
correct.
Yeah, and it was for a first offense. So this was a first offense for that particular thing. When we talk about second, third, fourth offense, we're talking about when we do the compliance checks or sales to a minor. So the one that you're talking about when they were first here, I believe that one was a sale to a minor, correct?
It was,
Yeah.
yes.
So if they get another sale to a minor, which we have been doing, we're doing compliance checks, we do them all along, that particular health inspector, is overseeing that. If they get a second sale to a minor within a certain period of time, I believe it's
3
36
years.
months. So within 3 years, they get a second one, then the fine goes up, and then also the suspension period goes up. So the first time, it was a $1,000 fine and a 3-day
3 days.
suspension. The second time, it's what, a
2,000 in a week,
in a week. The third time within 3 years,
5,000.
5,000 in a
And
month.
30 days.
So that's what kind of is the gradation thing, is when you sell to a minor. The other fines are, it's not set up as this gradation thing, it's more set up as $1,000, $1,000, or whatever. So you can't do the gradation with whatever this particular offense was.
So-
Do you understand what I'm saying?
I get what-
And then some of the fines are local fines. So this in particular infraction was a criminal fine. That's why we can do it for $1,000. If it's a non-criminal type of fine, which is, some of them are, then it goes into a different fining structure, which is $100, $200.
I guess I question, why is it a warning than a fine?
I don't think it was a warning, I think it was a corrected on site.
It
So What
was.
she said was, get rid of that, and they did. But then she went back to check again, so she did another inspection. And then when she went back to the second inspection, she found that they hadn't gotten rid of it, that they must have gotten rid of it and put it back. So that's why they got the fine. We do allow them to correct on site, because they'll be like, okay, and we hope that they're gonna, take it off and not put it back on, but in this case, it was put back on.
It begs the question that they didn't understand that that was a requirement to begin with?
I think she made it clear that.
Oh, I'm sure we
Yeah.
made it clear. That's why I'm suggesting that, are we sure that they didn't realize that what they did by putting them on the shelf in the first place was wrong? Because it seems to me like they would have known that.
So what was what was the
There's
issue?
there's photos of the product, so, there's always discrepancy with,
And it really
they argue with, well, it's not a flavored product, and, we have to explain to them, it is according to the ingredients, so we have a lot of back and forth sometimes with them, too.
And also, too, they don't always, they'll get a product from their manufacturer, whoever's selling them the products, right? And they'll tell them, oh, yeah, this is fine, this is okay. But when we get in there, we want to see paperwork showing that this has been stated to be a non-flavored product. And in this case, what it was is they couldn't produce that paperwork. So that was really what the fine was for, not producing that paperwork saying that this is not a flavored product.
So where
And
did
that's
they get the-
required
Where did they get the product from?
Off the
from
internet.
whoever they buy it from, which happens. Sometimes they don't, sometimes they'll buy the product, but they don't always get the paperwork.
And
to
Marlene,
go along
they
with
know they need the paperwork, right? I mean, they're in the business,
They should.
They do, yes.
you know?
Yeah.
Yeah.
Now, in addition to the health agent, we also have the associate health agent, the associate health inspector, who now who's going from, her last name is Ellsworth
That's
now.
right.
So we'll see that Ellsworth,
married.
Samantha Hardy has recently got married, and Samantha
exciting.
Ellsworth. Yeah. So is there anything as part of her report, because we'll take these two together, as we've done in the past? No, I have nothing. So do I have a motion to approve the health agent and the associate health inspector's report?
So moved.
I have a motion by Mary Beth Welch, second by
Gail DeMore.
Ms. Demore. Because spit it out. I'm speaking quickly. All in favor?
Aye.
Aye, 500. Thank you. The next is the environmental engineer. Christine, do you have anything you'd like to?
Sure. I had a series of fines that were given to a person who tore down a structure without obtaining a Board of Health permit. And under our regulations, that requires a hazardous materials disposal permit. And they demolished the structure without a permit and without a pre-demolition inspection. So that resulted in a series of 12 $50 non-criminal disposition fines totaling $600, which they ultimately did pay. And so that's been closed out.
Did they find?
Yep, they submitted the paperwork that we required ultimately and paid the fines.
Just for the public who may be watching, very a quick summary. Why do you need to do a demolition permit, and what are you looking for?
So we look for a variety of things, but some examples would be, chemicals stored in people's basements or in their garages, gallons of, paint, or not necessarily latex paint, but oil-based paints and stains, that type of thing. Used oil or unused oil products that they, never got around to using in their lawnmower and that type of thing. But also, some things that get overlooked frequently are any appliances that have a refrigerant in them. And as you can imagine, when you take a backhoe to a structure to demolish it, everything ends up in the debris. So you have to get all the potentially harmful materials out of that structure before they could be dispersed to either soil or groundwater.
Thermostats?
Yep, thermostats as well, mercury,
They don't contain mercury, okay.
older ones.
Okay. Any other questions for Ms. Mathis? Donald Road had a septic removal. We still have some septic systems in town?
Yeah, there's about 60-something of them.
60-something?
Wow.
I wasn't,
More than I thought, too.
yeah, more than I thought. Are there any other questions?
I have one quick question. So after something like that occurs, like a demolition that wasn't like, with a permit, so then do you have to actually inspect the soil underneath? Like, what do you do to know if there's been contamination or not?
There's not much you can do because everything's gone.
Done.
Yeah,
It's done.
everything was taken away from the site, and it was all hauled off at debris, so I did refer it to the DEP,
Okay.
in case they wanted to do follow-up
I
in
see.
terms of, asbestos testing and/or, further follow-up.
Thank you.
Do I have a motion to approve the environmental engineer's report?
Motion to approve.
So I have a motion by Dr. Mara El-Sabai. Do I have a second?
Second.
I have a second by Gail Demore. All in favor? 500. Okay, good. Which now takes us to the Associate Director of Public Health, Mr. Green.
Thank you, Chairman of the Board. I'd like to thank the Chair for his company at the Civic Expo on the 15th. Presented Board of Health information there, and that was very fun. I'd also like to bring the board's attention to our Board of Health intern. Jody Princicota started January, I believe it was 8th was her first day. And we have her for about 200 hours. She's a senior at UMass Lowell, and she's already completed a bunch of work for us, and she's working out fantastic. And you'll be glad to know she finished archiving all the newspaper articles that you sent.
Sorry.
It's a big job.
Does anyone have any other questions? Well, I like your summary of the story of our town's volunteer reserve corps. I thought that was very good, thank you.
You're welcome.
And you had questions from our fire department, a great fire department, about badging of EMTs.
Yes, yeah.
Tell us about that, because there's no explanation.
So in the past, we badged our volunteers as medical or non-medical, and that was based on their ability to vaccinate. That was really kind of a defining feature. We wanted to expand that a little bit and see if we could add other categories in there for maybe medical personnel who didn't vaccinate, but maybe they could do first aid, they could do blood pressure screenings, other medical events for us, but maybe not vaccinated. So I did reach out to Michael Donahue, Lieutenant Donahue with the fire department, and he did inform me that paramedics can vaccinate. So we could utilize them at our events, and then what we'll do for basic EMTs is have them do the blood pressure screenings and the first aid. So we'll be issuing, once we finalize our plans and everything, get that enacted, we'll be issuing medical badges for them as well.
Okay, great. Any other questions? Do I have a motion to approve?
So moved.
I have a motion by Ms. Welch, second by? Second by Mr. Maury. All in favor? Aye. 500. Okay. Which now brings us to our Director of Public Health. And first, welcome back. You're still tanned. I'm so glad you had a good time. She was away last week on vacation. Her report will include also the supervisory nurses report also. So, do you have anything to present?
For the nurse, we're starting the health fair, working on the health fair, so she's going to oversee that. We're currently taking applications from exhibitors. We have that on our website, and we advertise the PSA for that in the paper and on BCAT. So anybody who's listening who has something in the health field and they'd like to be at our health fair, they can go on our website and fill out the application. The actual health fair is going to be April 26th, so we decided on the date at the Burlington High School. So right now we're in the process of collecting all the applications, and the nurse is going to be working on that. She'll be working with, hopefully with the BVRC nurses to do a table for the BVRC on a subject, and assisting the public health intern if she has any questions with doing their table, as well as staff from the Tri-10 Collaborative who is going to do a table as well. So she'll be working with all those groups to try to get their tables together and any information that they might need.
Any other, for the supervisory nurse, any questions? Please let her know, I think her information table on the second floor is outstanding.
Yeah, we get people now who just come up to see what she has this month.
It's terrific. So please tell Ms. Troani that we mentioned that, please. It really is good. Now, your report.
So I finished up the fiscal year '26 requirements for the budget. As you know, you passed the actual budget, and I did the budget message and the Ways and Means cover sheet. The Board of Health is scheduled to go to Ways and Means on March 19th, and there'll be a subcommittee meeting before that. Usually what happens is our Ways and Means representatives will reach out to us a week or so before the March 19th to have the subcommittee meeting, and then we'll go to the actual Ways and Means meeting. And then in February, I need to have the annual report done, so I'm currently working on the fiscal year, last year's annual report. And I'll have that for you probably in the board book next month. Other than that, any questions on anything?
Any questions? Civic Plus, would you give a quick explanation with?
So that's tied into our software, it's called the environmental health software. So you'll see that a lot in my report, and the rest of the staff, you'll see environmental health, you'll see Tyler Tech, and you'll see Civic Plus. It's all tied in together. We're using funds from the grant to get this software up and running. It's going to be permitting and inspectional software. So Civic Plus is the public-facing side of it, where a permit holder can go on to this site, and then they'll be able to submit all their permit information electronically. It'll go right to us, it'll get into the software, and then we'll be able to keep all our files that way and keep all the inspectional reports in the software. So we're hoping to go live next week. So there's not going to be anything for permit holders to do at this point, because we're not going to have the Civic Plus or side of it up yet, because we're going to do a lot of data entry on our own. So a lot of it will be for our existing permit holders. They'll use it for renewal. And then once we get that up and running, any new permit holders, they can go on to Civic Plus and fill out a new permit. So it's going to take a while, because we have all our modules on this. We have food, we have hazardous materials, we're going to have animals and pools, and, everything that we permit is going to be on this software. And all the modules are complete, it's just a matter of getting the data into the software. So we've come a long way, we still have a lot of work to do, like after it goes live as well.
And I'm assuming it's cloud-based?
Yes, cloud-based, so that there's no server. So that was one of the things that we looked at when we got the software, and that IT recommended, is not to have it on a server, because if something happens to your server, then the whole thing is gone. But this is cloud-based, so that way it's, we don't have to have a physical server anywhere. It's all backed up through the company.
Okay. Anybody else? Last question, you did, just a note that you did a very nice report on, a response on fluoridation. I just want the community to understand that we do not make the water, nor do we certify the water in town. It is done by the DPW, and the water commissioners are the selectmen, but you did a beautiful answer on the fluoridation question.
Yeah, and I don't know if any board members have questions about that after looking at it, but it does go back many years. It was a vote of the town to do the fluoridation. And I don't know if you have any questions. I
Did a good job.
answer.
It was very well done. And, okay, so that brings us to,
One question, are you getting a lot of phone calls on that, besides that email?
No, so this, I provided this response, and then I got a response back, and I just haven't seen or heard that there's a lot of evidence to suggest. I mean, the report that was given to us was first of all, it was from a collection of a bunch of different reports. It wasn't one, study, and it was in, not outside of the United States, and the numbers that they were talking about were well above the numbers that, the fluoridation is currently recommended, which is the 0.7. So, I haven't seen any other type of proof saying that, this is an issue, so.
it pops up
Really,
every
it's
once in a
kind of to
while.
the contrary.
Every couple of years.
For many years, there's always, that question comes up, it has always come up, so.
Well, that's what I have. And do I need a motion? Sorry. I need a motion to approve the Director of Public Health report. Do I have a motion?
Second.
Motion with Demore, second by, I think it's Ms. Sheehan. All in favor?
Aye.
I have anything else somebody would like to bring up? With that, do I have a motion to adjourn?
Motion.
Mr. Maury? Dr. El Sabahi, all in favor? Aye. 500. Thank you, everybody. Good night.